Hello, I'm Heather Saavedra, and I'm a dietitian at the University of Texas Health Science Center at Houston. I have the privilege of working with many of you and your families. And today I'm going to talk about probiotics, fertilizer for your gut. There's good bacteria everywhere. There's also bad bacteria, but today we're going to focus on the good bacteria. The journal Cell had this nice picture taken from an electron microscope of some gut bacteria, and here it is. Probiotics are very popular. I think all of us have heard about them. They're widely advertised. This came from an advertisement, and this is one particular probiotic that's marketed for colic. And there's an asterisk on the bottom that says, these statements have not been evaluated by the FDA, and it's not intended to diagnose, treat, or cure, or prevent any disease. That's very important to remember. Today we're going to discuss what are probiotics, what are the proven uses, how do they work, and are they safe? Just some general information. There are more microbes or probiotics in the body than human cells. The colon is fully populated with them, and probiotics make up about 3% of the body mass. Probiotics are defined by the World Health Organization as live microorganisms that, when administered in adequate doses, confer a health benefit to the host, in this case, humans. So there are different species of them. I think most of us have heard of lactobacillus. Then there's the bifidobacter, and then there are some others that include some yeasts. These are some widely available probiotics on the market, and I've put the amount of probiotic cells and then the type in each one. And as you can see, they're made up of either one single one or a combination of probiotics, and then they all have differing amounts in them. Also, you can get food that has probiotic in it. Miso soup has it, kimchi has it, and then you can also buy this kraut organic. It's full of probiotics. They have some chips that are made from kraut. There's a gut shot. There's, of course, yogurt. And then there is an Aussie kefir drink. And in that one, there's 4 ounces, has 4 grams of sugar, which is important to remember. All of the others have been sugar-free. I was amazed to see that there's even a diet soda that has probiotics in it. Most of us have heard that probiotics are good to take whenever someone is taking an antibiotic. How did we get that knowledge? So everything first starts out in animal studies and then goes to case series or case reports, then case control studies, then cohort studies, a randomized controlled clinical trial, systematic review, and then meta-analysis. And that's where they look at a bunch of big studies to compare all the data. So for probiotics in 2014 and 15, there were some randomized clinical trials looking at hospital-acquired infections, eczema prevention, viral infections in the military, fasting glucose levels in obese pregnant women, glycemic control in the obese, and postoperative infections after colon cancer surgery. In these randomized clinical trials, the results were negative on whether probiotic helped them. And then during the same time frame, there were some positive results in these randomized clinical trials, and I've listed them here. One was the prevention of colic. You have upper respiratory infections in stressed undergraduates, influenza in children, bad breath, improvement in cholesterol, triglycerides, lipid panels, and then esophageal reflux in breastfed newborns, just to mention a few. And then 2017, there was a big meta-analysis that looked at all of these randomized controlled studies. And I have the number of the studies that each one reviewed. So for depression, they reviewed 5. Blood glucose in type 1 diabetes, there were 5 studies that were reviewed. There were 21 studies reviewed for irritable bowel syndrome, and so on. So I'm going to look at some of the pediatric studies in children. So they found that probiotics were effective in diarrhea, in treating diarrhea, the acute infant diarrhea, diarrhea associated with antibiotics, and irritable bowel syndrome. They were also effective in upper respiratory infections, necrotizing enterocolitis prevention, and then infant colic as well. And then in 2012, this was published, it's from a gastroenterologist guide to probiotics, and they looked at various probiotics, which I have listed here, and an A gave them a strong positive, that there was a lot of information that said that yes, it does help with this. The B, there were some positive cases, but a couple negative cases, but they thought some more work was needed. And then C, there might have been a couple positive ones, but a lot more negative ones, and they really needed to evaluate that more. So if we look at Fluorostor, it's been shown to have a strong positive track record in treating antibiotic-associated diarrhea and infectious diarrhea and treatment. The prevention got a B, and then Crohn's disease got a C. If we look at Culturelle, it's similar. The antibiotic-associated diarrhea got an A. The infectious diarrhea treatment got a B. C. diff prevention and prevention of recurrence of C. diff infections got a BC. So it wasn't quite as bad as the C, but it needs more information. And then Crohn's disease got a C. And then we have Visbiome, which is no longer available. It was pulled, but we have one very similar to it. It's been shown to be effective in treating ulcerative colitis, the maintenance of it, the pouchitis prevention, and then and maintenance. Ulcerative colitis, the induction of the treatment of that, and then it got a BC on irritable bowel syndrome. So that's kind of a report card that I thought was very beneficial. And we're going to go into which probiotic to choose in a moment. In GSD, there have been some studies, 2 studies done on probiotics. So the first one was done by the group in Brazil, and they were looking at GSD and microbial dysbiosis. So their conclusions were that an overload of cornstarch can lead to low fecal pH, which creates an acidic environment. This acidic environment could lead to changes in the amount of fermenting bacteria in the gut, which would decrease the conversion of unabsorbable starches to short-chain fatty acids. It acts as an environmental selection factor to bacteria in the intestine. Then there were 2 types of bacteria that were overrepresented in the gut of these GSD patients. Actinobacter and Proteobacter were overrepresented. Both of those are a sign of inflammation, and they show up whenever chronic disease is present. So that wasn't too unexpected. Then Urachia bacteria was underrepresented. The microbiome presented low diversity and highly dominated by Escherichia and Shigella bacteria. There was a study out of Spain that looked at GSD and VSL number 3. It was on 1 36-year-old male with type 1A and IBD-like disease. 3 doses were given, a normal dose, a half dose, and no dose. They found that the full dose showed the most improvement and symptoms recurred after the treatment stopped. The half dose produced less severe symptoms. So the take-home message is that they found that there was improvement whenever the full dose was given. As we talked about before, there have been many studies on probiotics. The benefits of them have been shown to help with bad breath, colon health, help with digestion, helps with colds and flus, immune system booster. It's kind of like the miracle cure for everything. And there's been a lot of publications on that. The sales of probiotic supplements is astronomically high. In the US, it's $1.3 billion in 2005. In Asia, it was 15 billion. So they use a lot more probiotics than we do in the US. How do probiotics work? Here's a diagram looking at one specific probiotic, L. reuteri, but they all work similarly. They help inhibit the bad bacteria from sticking. They also secrete antimicrobial compounds, Reuteri in this case. They increase the mucus layer thickness in the gut, and then that enhances the barrier function, so it tightens the junction between the cells. It interacts with epithelial cells, and then it can affect the nervous system by modulating gut motility. Probiotics, the main function of them is to decrease inflammation. Whenever you decrease inflammation, you can prevent colic, you can improve lipid panels, you can have an improvement in IBS, you can decrease esophageal reflux in breastfed newborns, and you can decrease the duration of diarrhea during illness. What creates the benefit? We still don't know. Is it the dose? Is it the composition? Is it the person's gut flora? It's probably a combination of 3. So what that should tell us is that if you try one and if it doesn't work for you, you might want to try another, because every person is different, and you should talk to your clinic about that to get the best information. The FDA, I mentioned this early on, and to date, the FDA has not approved health claims for any probiotic. And that's very important to remember, that yes, there is some research that shows that they are helpful, but to date, the FDA has not approved health claims for any probiotic. Are they safe? Which is not true according to the FDA. Here's a quiz. Currently marketed probiotics are safe if sold in certified pharmacies. A probiotic should be regulated as a vaccine. Probiotics have been reported to cause endocarditis, and probiotics have been reported to cause sepsis, or infection. Which one of these is not true? It's currently marketed probiotics are safe if sold in certified pharmacies. That's the untrue statement. All the others are true, according to the FDA. So I would like to thank the following people: Dr. Rodriguez, who is our GSB physician at our clinic, Dr. Mark Rhodes and Nicole Feathery, his research assistant, who helped me a lot with this presentation. And then I would like to thank all of my patients and the families that I work with on a daily basis. Thank you.